Indiana Newsdesk is made possible in part by Smithville, fiber internet, streaming TV, home security, and automation in southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis, lawmg.com. The IU School of Education, preparing teachers, scholars, and administrators to improve teaching in Indiana and around the world. education.indiana.edu. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. It's a common drug their lives depend on, but the sky-high cost has some Hoosiers rationing insulin.
Because I don't know how or why they could think that someone can afford $1,000 a month alone in prescription medicine, and it's life-sustaining medicine at that.
But a new generic from Eli Lilly could provide some relief. Some kids end up in Indiana's juvenile detention centers when they shouldn't. Now a program that aims to change that is at risk of ending.
We save the state thousands, if not over hundreds of thousands of dollars in doing what's right for these kids and getting them out.
Its fate is in the hands of the state legislature. And Bedford native and IU great Damon Bailey is set to be inducted in the National High School Hall of Fame. Those stories, plus the latest news headlines from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Insulin is not a new drug, but even though it's been around for nearly a century, its price continues to climb. People who suffer from type 1 diabetes have to take it to regulate their blood sugar. But as Sarah Whitmire reports, a recent study shows as many as a quarter of people who need insulin ration it because it's too expensive.
Sarah Skipper says she's doing okay now.
So I've really just received a lot of donations recently, and I mean, that's really been helping out a lot.
But it's a new feeling, despite having insurance and a full-time job. Just as recently as a couple months ago, Skipper was putting herself in risky situations, trying to ration her insulin or borrow from her sister, who's also a type 1 diabetic.
When I'm using her prescription, I mean, it's taken away from her. So if she runs short, then it's just like, you know, it's like a double-edged sword, kind of, which we ran into some trouble last summer. We were sharing a vial of insulin, and I had took my portion, and somehow our wires got crossed, and she took half of hers, thinking that I hadn't already taken mine, and so the next day she ended up like sick and was in the hospital for 4 days.
Skipper recently decided to talk publicly about the challenges she faces.
This isn't something that, of course, we want to do. It's a life or death situation.
And she was met with an outpouring of support and insulin donations. Her story is similar to those of a lot of other people who struggle to afford the insulin they need.
I certainly have patients who have either reduced the dose or skipped it completely.
The problem is, if they reduce their insulin, their blood sugar will rise higher than it should.
You know, if it was just a number and it had no consequence, diabetes wouldn't get nearly as much attention as it does.
Higher numbers over a period of time can cause serious medical problems, including blindness, kidney failure, an increased risk of heart disease and stroke, and even death. Dr. Hancock says at least 3 or 4 times a day, a patient mentions some sort of struggle in paying for their insulin. According to the American Diabetes Association, the price of insulin nearly tripled from 2002 to 2013.
There's 3 companies who have total control over this market, and they have a customer base which absolutely has to have the product to survive. So they can raise it to whatever price they want to, and to be honest, they have raised it to this enormously high price. And people still pay it because they must pay it to survive.
Those companies are Sanofi, Novo Nordisk, and Indianapolis-based Eli Lilly. Eli Lilly did not respond to multiple requests for comment, but the drug makers have long said their prices reflect the time and the effort it takes to develop products and the risks the companies take on.
There's been some really important recent research that analyzes the cost of manufacturing insulin, and the estimate is it costs about $5 to manufacture the same vial of insulin that has a list price of as much as $300 or more.
Drug company executives were called before Congress last week to explain their prices.
As a physician, I do recognize that medicines are only helpful if patients and healthcare systems can afford them.
Eli Lilly wasn't there, but in response to growing pressure, the company announced this week it would begin selling a cheaper version of its top-selling insulin, Humalog. In a statement, Lilly's chairman and CEO David Ricks wrote the cheaper insulin will be available to address gaps in the current pricing system. For people with diabetes, he wrote, a lower-priced insulin can serve as a bridge that addresses gaps in the system until a more sustainable model is achieved. But while critics say the half-price generic is good, they think Lilly and other drug makers could still do a lot more to lower prices while continuing to make a profit. Dr. Hancock says there's plenty of blame to go around.
Between the patient and their drug manufacturer, there's me, there's the doctor, there's the pharmacy, there's the insurance company, there's the pharmacy benefit manager, there's the wholesaler, and then there's the drug. Right? So as that drug moves through the chain, every time it changes hands, that's an opportunity for a fumble.
There's no superfood or anything that's going to get rid of type 1 diabetes. You have to have insulin or you will die. And it just doesn't make sense that it's this hard to get it. I mean, if we don't have it, we die.
For Indiana Newsdesk, I'm Sarah Whitmire.
With us is George Huntley, a longtime diabetes advocate and a former national chair for the American Diabetes Association and an Indianapolis resident with type 1 diabetes. George, thank you so much for coming on.
Thank you for having me.
So let's just start with the structure of how these drugs are priced.
They're very convoluted, but you have a list price that the uninsured or underinsured pays. Then there's a rebate and discount off of that list price that gets to the net price that the manufacturer winds up keeping. In the case of insulin, list price is like $300 a vial. Net price is around $68. So there's over 70% of rebate and discount that's going through to the middleman, the pharmacy benefit manager, and they're purchasing market share in the process.
So is that where people like yourself and advocates are working to try and get these prices down? That's
Exactly right. We're trying to get rid of that swath that the middleman is taking out, because patients are being impacted at list price. So I'd say they've played the game of raising the rebates, which they're raising the list price to go along with it. So the manufacturer's still getting what they're getting, and they're just raising the list price. And until patients started to pay it through high deductible health plans, it wasn't really a problem, but now it's a very serious problem.
So why does this have to be so complicated?
Oh, that's a good question. Yeah.
It's kind of the $100,000 question, isn't it?
Yeah, it's because people want to make money.
Yeah.
That's really the fundamental piece, is everybody along that food chain. That was a very interesting graph, that chart that was put up there. Mm-hmm. Every block on there wants to make a buck.
So why are we just now seeing the political pressure put on our legislators?
We're getting louder. Okay, so the political pressure happens when everybody's voice just gets louder and louder. These high deductible health plans are getting more and more prevalent, so more and more people are exposed to list price, and that's really what's happening.
So now how about this new generic lower priced insulin? Will this affect other companies as well? I mean, we'll see a chain command.
It very much could. Lilly had to go out and actually get this FDA approved, even though it's the same drug, but they had to go back through. What they've really done is broken their contract, in my opinion. I don't see those contracts, but I think they've broken their contract with Express Scripts from the standpoint of, I now have a new drug that is not necessarily under that old contract, so that rebate that we had agreed to doesn't exist on this one, so I can lower the list price and set it where I want it to be.
And how do you promote transparency among insulin providers?
That is a very difficult thing, because they won't all get together and share it with you. So that is, transparency in the entire system as to what is net, what is list. It is just really coming, because there's a lot of pressure on that right now.
All right, well, thank you very much for being here today and shedding some more light on the situation. Appreciate it.
Thank you.
A program that helps kids get out of Indiana's juvenile detention centers when they shouldn't be there could end later this year if the state legislature doesn't fund it. As Barbara Brosier reports, the Indiana Public Defender Council is requesting a small boost in its budget to keep the Juvenile Defense Project going.
Courts should be telling you this. There's a specific statute.
Attorneys from Indiana's Public Defender Council have done orientations with more than 1,000 kids in the state's detention centers over the past 2 years. The goal is to help educate them about their legal rights. Some of the juveniles end up in detention when they shouldn't have. Sometimes it's because they didn't have an attorney at a crucial point in their case, or because the attorney assigned to the case wasn't effective.
Right now, I know of 3 cases referred by the Juvenile Project directly that ended up at the Indiana Supreme Court.
The council says that's a huge impact. Data from the Indiana Department of Corrections' 2017 annual report says it costs nearly $265 per day to house a juvenile in a detention center.
We save the state thousands, if not over hundreds of thousands of dollars in doing what's right for these kids and getting them out.
And visits to detention centers are just part of the Juvenile Project's mission. It's also worked to educate attorneys about the intricacies of the juvenile justice system. But federal grant funding that supports the project is set to run out in August. That's why the Public Defender Council is asking legislators to boost its annual budget for the next 2 years to keep the program going.
It's less than $160,000 a year, what we're asking for, just to continue the work that we've been doing, the training, the technical assistance to attorneys, and then also working with kids and making sure that they're represented.
Without that funding, the Juvenile Project will end later this year. And Wenicky says that puts the liberty of kids in Indiana's detention system at stake.
I know of at least 5 kids that we have gotten released early from the Department of Correction because their rights have been violated to the extent that either the courts or actually the prosecutors in most of those situations agreed that they should have not been sent to the Department of Correction the way that it happened.
The Public Defender Council hopes the state legislature will find room to fund the program as it tweaks its budget proposal in the coming weeks. For Indiana Newsdesk, I'm Barbara Brosier.
And now a quick look at headlines and the latest on this week's top stories. State lawmakers are edging closer to allowing pharmacists to deny women access to abortion-inducing drugs. Current law lets doctors and hospital employees refuse to provide or participate in abortion services. Now, proposed legislation would extend that to nurses, physician assistants, and pharmacists. The House Public Health Committee advanced the bill 9-4 along party lines. There isn't consensus among legislative leaders as to whether the Department of Child Services will get the $300 million annual increase it's asking for. DCS officials have said for months they need $286 million per year that the agency got in the last budget. But lawmakers say things are getting better. Caseloads are down and case manager turnover is decreasing. That has them wondering if DCS needs as much as it's asking for. The Indianapolis Metropolitan Police Department is partnering with an online service that allows citizens to track and report crimes. CrimeReports.com features an interactive crime map, search functionality, and the ability to provide police with anonymous tips. IMPD officials often say a lack of trust from community members has created some environments where witnesses refuse to talk with police. Mayor Joe Hogsett says he's hopeful the new online tool will help. A new round of testing is looking at the extent of contamination in the Indianapolis suburb of Franklin, where cancer-causing chemicals have been found in groundwater and sewer vapors. Over the last week, the nonprofit Edison Wetlands Association, which has been working with parent group If It Was Your Child, returned to Franklin to conduct sampling with the gas chromatography machine. Nearly 36 homes were tested, particularly near a site with a documented history of contamination that has migrated under residences. A 5-year plan to invest around $30 million in roads and trails in Monroe County is open for review. The group putting the Transportation Improvement Program together held 2 meetings this week to hear input about the kinds of changes residents want to see take priority. There are dozens of projects slated for funding, from trails to sections of new roads. Planners say the projects work together to improve overall mobility in the county.
It's a synergistic approach, of Monroe County, City of Bloomington, Bloomington Transit, Rural Transit, Town of Ellettsville, and IU Campus Bus.
Martin stressed that public input should be concerned with the kinds of projects residents want to see and not specific projects. The public window to comment on the plan closes March 25th. Final approval from INDOT is scheduled for May of this year, with initial spending slated for the beginning of July. Indiana University student Lauren Spear's disappearance 8 years ago was listed by Time magazine as one of the most mysterious of all time. 20-year-old Spear was last seen on June 3, 2011. Spear is on the list along with Malaysia Airlines Flight 370, hijacker B.D. Cooper, Jimmy Hoffer, and Amelia Earhart. The case drew national attention. Despite years of investigations, no arrests have been made, and her disappearance has remained a mystery. A Martinsville sock manufacturer says it's not going anywhere after its recent sales to a private equity firm. As Becca Costello reports, For Bare Feet Originals says the deal will ensure the company's future growth.
If you've ever worn socks showing your pride for your favorite team, there's a good chance they came from this Martinsville factory. For Bare Feet started in just a 10 by 15 foot retail location, but now turns out thousands of sock designs every year. And that growth is expected to continue under the new ownership of Taglich Private Equity.
We very much want the company to move forward and continue to grow, and with the same culture and dynamic and aspect of what we originally intended it to be.
They're adding a few jobs as part of the transition. The founder's daughter will stay on as CEO and says they plan to become even more involved in the local community under the new ownership. They'll open a new factory store and start tours of the factory in May.
We have no intention of leaving. We actually intend to facilitate and build more into the company and into the community.
And that could even include expanding the factory down the line. For Indiana Newsdesk, I'm Becca Costello.
Former IU basketball star and Bedford native Damon Bailey headlines a 12-member group to be inducted into the National High School Hall of Fame. Bailey led the Bedford North Lawrence Stars to a state championship and is the highest scorer in Indiana boys basketball history. He burst onto the scene in 8th grade when Indiana Hoosiers coach Bob Knight started attending his games. After his time at IU, he went on to play pro ball. Coming up next on Indiana Newsdesk. Now that Bloomington has an interstate freeway, we answer one local's question about why it took so long. And the city of Bedford is finishing up a half-decade's worth of downtown renovations. What city leaders hope those upgrades will do for the community? These stories and more right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
In a time of change, where can you find in-depth reporting and thoughtful analysis? Washington Week on PBS. Join moderator Robert Costa.
When I was at the Capitol this week, I encountered the same.
And a panel of award-winning journalists.
You're seeing a divided nation, and you're seeing.
For insights and perspective.
Tonight there was a key development in the
Senate. You won't find anywhere else.
What a week.
Washington Week.
Welcome back to Indiana Newsdesk. With Section 5 of I-69 finished and construction of Section 6 already underway, Bloomington is now connected to the rest of the U.S. with an interstate highway. But as part of our Inquire Indiana series, Bloomington resident James Brozier, yes, that's the husband of my colleague Barbara Brozier, wanted to know why it took so long.
Indiana has earned, in more than one way, its reputation as the crossroads of America. It was a Hoosier, Carl Fisher, one of the founders of the Indianapolis Speedway, who conceived of the Lincoln Highway, one of the first routes to connect the coasts. And it was a Washington, Indiana man who envisioned a NAFTA superhighway that would connect Mexico to Canada. David Graham lobbied for more than a half century for an interstate that would connect his town to the rest of the country. James Brozier wondered why it took so long.
When the interstates were built in Indiana in the 1970s, why did Bloomington never get an interstate?
To find that out, I spoke with Matt Dellinger, author of the book Interstate 69, The Unfinished History of the Last Great American Highway. He says it seems logical that a city like Bloomington, centrally located with a long history of industry and the largest university population in the state, would be connected to the interstate system. But he points out that Bloomington is the 7th largest city in Indiana.
In your question is an assumption that the top 7 cities in every state should be connected to each other by interstate highway. If you looked at a map of the U.S. where that assumption became true, we would have 4 times as many highways as we have now.
But Brozier is surprised that Bloomington didn't get special consideration when those building projects were underway decades ago.
The one reason I always thought Bloomington deserved, an interstate earlier than it got one was just because the state's university is here.
Dellinger says while there are other considerations at play, the real driver of road construction in America is economics.
The building of roads in America has always been about the economy. Troops, there's kind of a myth that the interstate system was designed so that you could land an airplane every county had to have a stretch of highway where you could land an airplane. That is not true.
He says the opposition to construction of I-69, which was especially strong in Bloomington, is a good indicator that for many residents, access to an interstate highway didn't outweigh environmental and quality of life concerns. And he points out that even though until very recently there wasn't an interstate highway running through Bloomington, it's not as if the city was remote or isolated.
It wasn't as if, no one could get to Evansville from Indianapolis until I-69 was built. You could drive down through Louisville and over on divided 4-lane highways. You could drive over to Terre Haute and down on 4-lane highways. But it took you 15 more minutes or 17 more minutes or whatever it was.
Now the city of Bloomington is connected to an interstate highway as construction of I-69 continues northward toward Indianapolis. But for a lot of Hoosiers, what it really means is the commute from Bloomington to Evansville is down by about 15 minutes. For Indiana Newsdesk, I'm Tyler Lake.
And that is just the latest story from our Inquire Indiana series, but there's more to come. We want to explore the questions you have about the Hoosier State. You could even be part of the process as we dig deep to find the answers. Just go to WTIU.org/InquireIndiana and tell us what you want to know. It's been 5 years, but the city of Bedford is nearly finished with the major downtown revitalization project. As Azra Jalen reports, the city worked with community members to prioritize the things they thought would improve the quality of life in Bedford.
The city of Bedford was awarded a Stellar Communities grant in 2013. But Mayor Shauna Gurgis says the preparations actually started long before then when the city published its first comprehensive plan in 25 years in 2010. Gurgis says the initial comprehensive plan for Bedford's renovations was too broad for the Stellar Communities project.
So after getting that first year's feedback, of course, we went back to the drawing board and said, okay, what can we do different? How should we approach that? So we really narrowed our scope just to the downtown area.
As part of the Stellar Communities project, the city relocated the historic train depot, renovated downtown building facades, and moved Stonegate Arts and Education Center into its new location at the Gurgis Building on the town square.
You really have to have the participation of the courthouse because it's the face of the downtown. So and we were just fortunate that they were already working on the courthouse building itself, and so we were able to work together on the grounds.
The city held several public meetings to hear what the public wanted to see change in their community. Gurgis says one thing residents wanted was trails, which she says is the type of amenity that increases quality of life.
So we want to be the kind of community that people go, yeah, this is a place we want to be, that we can see ourselves living here, raising our family here, hoping that they stay here. So I'd say that's one of the end goals for sure.
In all, the renovations total about $20 million. That includes contributions from local businesses like the Bedford Times-Mail, General Motors, and Hoosier Hills Credit Union. For Indiana Newsdesk, I'm Azra Jalan.
And a new exhibit at the Monroe County History Center features items from the former RCA factory on Rogers Street. The building opened in 1940 for the Radio Corporation of America, manufacturing radios and then later televisions. During and following World War II, around 80% of the workforce was women. The factory played an important role in shaping the local community. Workers at the center say Bloomington's tradition of powerful female figures can be dated back to the RCA factory.
I think it's real powerful for people to grow up seeing their mom do this, or mom or grandma or sister go do this physical labor and come back and, they're providing for the family.
The exhibit showcases old RCA products, a television gift set that was gifted to Herman B. Wells, and old factory outfits. The plant closed in 1998, but the exhibit will be on display until April. And that's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville, fiber internet, streaming TV, home security, and automation in southern Indiana. More information at smithville.com. Maller-Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis, lawmg.com. The IU School of Education, preparing teachers, scholars, and administrators to improve teaching in Indiana and around the world. education.indiana.edu. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members, thank you.